Welcome to Electrode Application and Removal Training. This educational video aims to enhance the efficiency, experience, and skills of individuals in using Dena chest electrodes. Electrode placement. The first step is determining the correct site for chest electrode placement. Proper electrode positioning on the patient's body can significantly impact achieving optimal results. Select a site without bony prominences to maximize conductivity and avoid areas with large muscle mass to minimize muscle interference. Site preparation. Always ensure that the skin is completely dry before placing the electrode. Also, whenever possible, avoid using alcohol for skin preparation, as it can dry out the skin, increase skin impedance, and cause interference with the heart's electrical signals. If alcohol does not fully dry, it may also lead to skin irritation. Electrode application. After preparing the skin, remove the protective liner from the chest electrode and place the electrode on the prepared site. To ensure proper adhesion, activate the pressure-sensitive adhesive by rubbing your finger around the electrode in a circular motion. Repeat this process for each electrode. This technique helps produce a stable, high-quality signal. Electrode removal. To reduce patient discomfort during electrode removal, gently peel the electrode in the direction of hair growth. To prevent skin irritation or damage, do not pull quickly or at an upward angle. Be sure to support the skin adjacent to the electrode during removal. Electrode storage. When using bulk packaged electrodes, store unused electrodes in their original foil packaging. Storing electrodes in drawers or boxes may cause the gel to dry out, leading to signal quality issues. Benefits of proper electrode preparation and application. Correct skin preparation and electrode placement, which takes only a few seconds, provide numerous benefits for both healthcare professionals and patients, including high quality and stable electrical signals, better electrode adhesion, extended electrode usage time, reduced frequency of electrode replacements, increased patient satisfaction, less time spent troubleshooting weak signals, allowing staff to focus on other tasks. This educational video is produced by Dena, a manufacturer offering a complete range of chest electrodes for children, adults, and neonates.